So the country's healthcare industry has been pounded by the impact of COVID-19. But it's not all bad news. As we work to recover, there's been progress along the entire healthcare system, including digital transformation. Now the National Health Insurance, and how's the National Health Insurance going to be impacted by this, if at all? Well, let's get that answer and more with Etienne Dreyer, who's PwC's healthcare consulting leader. Thank you very much for your time this afternoon. Maybe let's start with that very question of how talks of NHI would be impacted by the adaptations that have had to be done over the last 2 years because of the pandemic.
Thank you so much. And I think that what we have seen over the last 2 years is a lot more collaboration between the public and private sector. We released a piece of thought leadership today where we had interviewed 31 of the top healthcare leaders in South Africa across the public and private sector. And we asked them what their thoughts around NHI are and how COVID would impact the National Health Insurance moving forward. And there was a unanimous response. 100% of respondents said that they support the concept and the framework of universal health coverage in South Africa. It's very much needed. We've needed it for quite some time to bring about equity and access to all South Africans. But we also see that there is a lot of opportunities for collaboration. There's been a lot more discussion during the COVID pandemic with regards to public-private partnerships, as well as how the private sector can contribute towards the implementation of a national health insurance. And a great example of that during COVID that we saw was when the private sector hospitals were accepting uninsured patients into the facilities, and there was an agreed to tariff by the state to pay for the COVID patients. So we think there definitely has been a lot of progress, and COVID, ironically, has been a catalyst to really get the conversation started and for public and private sector to come together for NHI dispensation.
Barring those collaborations and the partnerships that you've just spoken about between private and the public sector, overall, do you think that South Africa is ready for NHI? And I ask this question because I'm thinking about issues of infrastructure and actual human capital and other resources to make this happen.
Yes, and I think that any country across the world which tries to embark on a national health insurance plan, the WHO says that the expected time frame is a 15-year implementation, and that's across most developing countries. So we can't be fooled into thinking this will be an overnight success, that it'll be an overnight implementation. There are a lot of basics which have to fall into place. Basics, as you've mentioned, with regards to infrastructure, resourcing. But there are also a lot of innovative ways in which we can get around them as a country. There's been a lot of technological and digital improvements and innovations which we've seen during COVID, where people are able to get consultations remotely over their cell phones, where previously it was not as popular and as readily available. So we probably need to think a lot more innovatively, and the old model of building more hospitals and creating these big centers of excellence, globally we see that that's no longer the trend. And the respondents to our survey, they back that up to say that almost 100% of the organizations are putting digital plans in place and digital strategies in order to disrupt how healthcare is being delivered in South Africa across the public and the private sector. But you are right, there is a lot of basics that have to be put in place with regards to upskilling of resources specifically, and globally there is a shortage of healthcare workers. So we need to come together and think creatively as a country in terms of how we can leverage the resources that we have got at our disposal.
And as we look at those resources that we do have at our disposal, you've mentioned there that innovation is going to be a key to making this happen. But also there's going to be increased risks of cyber attacks. Over the last 2 years, we've had many people take advantage of people's data holding agencies, for example, where there'd be cyber attacks at banks and the likes. And I mean, surely in this regard, when we take into consideration technology and the like, the risks of cybercrime will also increase within the healthcare space. And so one would have to think about how that space would be protected.
Absolutely. And in our thought leadership piece, cyber attacks on healthcare data was one of the top risks identified by all of the healthcare leaders in South Africa. what we did see during COVID was a huge uptake in cyber attacks on healthcare organizations. And I think that a lot of cyber criminals realized the ability that the healthcare data has. It's such rich data. It's got personal information, health information, banking information. So the target of health data is a global phenomenon, and we're not going to get away from that. What we have to do is we have to make sure that organizations, both public and private, have got their cyber risk plans in place. They've got their protections and their fail-safes, which are being tested on an ongoing basis, and also thinking one step ahead of the curve, trying to get ahead of what the cyber attack look like in the market, and thinking on an ongoing basis. Our report showed that only 21% of the organizations we surveyed, healthcare organizations, felt that they are covered enough for a future cyber attack, which shows that as an industry, we really do feel unprepared and we are at risk. But that is exactly why there has to be a very clear action plan put in place on an organization level and also on a National Department of Health level as we embark upon all of the data that will fall into a national health insurance.
Etienne Dreyer, thank you very much for joining us this afternoon. He's PwC's healthcare consulting leader, talking us through NHI and the opportunities that are presented with it here in South Africa.